Yeah, so it's just definitely been a challenging time for everyone. I really appreciate an opportunity to stop and kind of recognize what this time has meant for elders, and the lessons learned from this pandemic. One of the major issues is around social isolation, and it is really challenging. Think about this. It's really challenging to be in your rooms all day long with little activity. It's devastating to not have family and friends being able to visit with you in your home, or even have your housemates being able to visit with you in your room. And one of the challenging things that we also know is that, residents weren't able to be out and about in community to participate in recreational activities through their adult day program, to go shopping or to get their hair cut or to even get their hair done. And so I will share with you one of the stories, one of the cases that came to us. A family member contacted us about their loved one in an assisted living home. The loved one had not had her hair done in over 6 months. So when we asked what that did that mean, that resident had not been able to have her hair washed or conditioned or braided. The resident was an African American woman who is used to wearing her hair in braids, and the staff did not know how to actually do her hair. And so we worked with the family member and the staff to set up some time on FaceTime so that the staff could guide, so that the family member could actually guide the staff on doing the resident's hair, and that worked out well. So the resident was able to get her hair washed, to get her hair conditioned, and to get her hair braided like she wanted. That's just one of the cases that we worked on, and there are many others. We've also talked with residents who are feeling guilty about living through the pandemic when their friends did not. And that's been a tough situation for those residents. We had one resident who was in a home with two other residents, and two of those residents passed away. And that resident remained in that home and just really had a sense of guilt and trying to understand why she lived and her housemates passed away. So dealing a lot with the depression through the pandemic, and again, as we're moving back into uh, you know uh, normal activities, residents are happy about the plan to vaccinate and to get vaccinated and to again experience having visitors in their homes. And this has just been quite the year for our residents in long-term care facilities. And we're just hoping that those lessons that we've learned will not go unnoticed.
So we've heard a little bit about the experience of people who have been living in long-term care facilities. So now I'd like to turn to Sandra. What have you and your colleagues been hearing from older adults and even people with disabilities who are living in the community? What have their experiences been?
I think for the most part, their experience have been is losing their caregivers due to COVID. And either the adult has COVID or the caregiver, someone in their family has COVID. And so that's been the biggest challenge for them is trying to choose between, do I go into an assisted living home because now I don't have a caregiver who can come take care of me, or what do I do? And so our office is trying to help them make that decision on how do we keep you in your home while facing this COVID challenge. So that's been the biggest challenge for us. The other part of that is that a lot of the providers here would come into the homes without proper PPE. And so the clients would feel unsafe to let them in. And so do they go without a caregiver, or do they allow this caregiver without PPEs to come in and care for them? So those have been the biggest struggles that we have been facing. And I think the third struggle we faced is a caregiver who maybe has developed COVID and the adult doesn't necessarily test positive, and the caregiver needs to isolate. So that caregiver is the husband or the wife or the child of that adult. And so how do we isolate them without losing that connection or getting someone else in there to care for them? So those have been some of the challenges we've faced in our community.